of Louis Pasteur. Louis Pasteur एक केमिस्ट था, along with that वो माइक्रोबायोलॉजिस्ट भी था. लुइस पास्चर ने दुनिया में पहली रेबीज वैक्सीनेशन बनाई. तो उसको ये क्रेडिट देने के लिए हर साल 28 सितंबर को ये मनाई जाती है. अब 28 सितंबर का भी वो सर्कुलेशन में ना वीकेंड्स आ जाते हैं, तो फिर वीकेंड्स में मुश्किल हो जाता है. तो फिर हम या ये कह लें कि पाकिस्तान में ये अरेंजमेंट्स होते हैं कि या एक दिन पहले जो लास्ट वर्किंग डे है उसमें कर लेते हैं, या फिर उस वीकेंड्स के बाद जो है वो करते हैं. तो अकॉर्डिंगली कुछ जैसे एरिड है, दूसरे लोगों ने वो सैटरडे को आ रहा था तो फ्राइडे को कर लिया. हम लोगों ने ये ट्यूसडे को रखा कि ओके हम मंडे को अरेंजमेंट्स कर लेंगे और ट्यूसडे को मनाएंगे. तो ये इस तरह से. अब इसमें इंटरनेशनल के बड़े बड़े पार्टनर्स हैं, वो मेरे ख्याल में आपको फारूक भी बताएगा. जो ह्यूमन हेल्थ के पार्टनर्स हैं लाइक CDC है अमेरिकन, वो इन्वॉल्व होता है, WHO इन्वॉल्व होता है. हमारे जो पब्लिक हेल्थ यूनिट्स हैं बड़े लाइक नेशनल पब्लिक हेल्थ इंस्टीट्यूट है, जिनको पहले हम नेशनल इंस्टीट्यूट ऑफ हेल्थ भी कहते थे, वो पार्टिसिपेट करता है क्योंकि ये हमारे डोमेन है कि इस तरह के जो भी पब्लिक हेल्थ इनिशिएटिव्स हैं उनको हम कैरी ऑन करें और उस पर हम काम करें. इंटरनेशनली इसके सिवा और भी जैसे ग्लोबल अलायंस फॉर रेबीज है, वो भी इसमें इन्वॉल्व होता है और वो भी इस पर करता है. एक दो और भी एजेंसियाँ हैं जो इंटरनेशनली हैं, वो सारी मिल के ये सेलिब्रेट करते हैं. ऑब्जेक्टिव्स क्या है इसके कि ये आप क्यों करते हैं, रेबीज डे मनाने का क्या फ़ायदा है. बेसिक चीज़ ये है कि आप एडवोकेसी करें, आप इस चीज़ को फैलाएं कि इसमें ये मेयर्स लें और इस तरह से आप बच सकते हैं. ये स्टेज वो स्टेज इसमें सेमिनार्स के थ्रू, कभी वॉक्स के थ्रू, कभी मैराथन रेसेस होती है. इसमें कभी कभार ये होता है कि सब साइड एक वैक्सीनेशन कैंपेन चलाई जाती है फॉर डॉग्स. तो ये मुख्तलिफ स्टेप्स हैं जिनके थ्रू ये हम सेमिनार करते हैं और ये एक्टिविटी एक डे मनाते हैं कि ताकि ये रेबीज़ को हम सोच जो है रेबीज़ के लिए वो हम डेवलप करें और हम इसको आगे बढ़ाएं. जब पहले 2007 में ये किए गए थे तो पहले चंद सालों में ये कोई मुख्तलिफ मुल्कों में कोई 1700 के करीब एक्टिविटीज हुई थी. एडवोकेसी करें और इस चीज़ को बढ़ाएं, फैलाएं. तो इसमें यकीनन आप लोग सारे हमारे साथ होंगे. तो मैंने तो अपनी तरफ से बस यही कहना है. और अलॉन्ग विद दैट में मेरे ख्याल में क्योंकि 15 मिनट हम पहले ही लेट हो गए, तो रिक्वेस्ट करूँगा फारूक को, डॉक्टर फारूक आ जाए और थोड़ी सी टेक्निकल लेक्चर है इसमें और उसके बाद बात है. जरा हम बात करें.
Recently it had been highlighted in media due to different reasons, but and because we're all technical people, we have biological background, so although I've got a very typical rabies epidemiology presentation, but I'll be talking more about what sort of work NIH has done in recent past on rabies and what could be potential for NIH to lead their way into this rabies program, and how we could potentially go forward to what world has dreamt of, like rabies zero in 2030, and to eliminate this disease by 2030, and what are the footsteps we can follow. So generally for the very basic background, we'll start obviously with the rabies etiology. What rabies is, usually it is transmitted through many animals, primarily through dogs, but in Northern American countries and different regions we have fruit bats that are responsible for the transmission of rabies as well. So main cause is dogs, specifically rabid dogs, and majority of its occurrences are in Asia and Africa. It is usually associated with the socioeconomic status, where there are more unhygienic conditions, and there is no control over stray dogs, and ultimately that lead to spread of this disease. Again, it mostly occurs in vulnerable populations because of uncontrolled dog population growth. Mostly the kids of 5 to 14 in their teens, they are most affected as they are more prone to dog bites from the stray dogs. And just for a gauge of the burden of this disease, that about 29 million people receive almost rabies post exposure vaccination every year. So you can just imagine the load of this disease that is there. In Pakistan, again, there is no difference. We have primarily dog mediated rabies, and as we have been talking about, that there are inadequate vaccination due to certain reasons, the lack of import, and kind of lack of local production and low local production capacities. But transmission, it usually is transmitted from the dog bite. The virus is there in the saliva of the affected dog and infected dog, and once there is bite, it is transmitted to that person, and then it transmits along the nerves, and once it reaches the nervous system, central nervous system, then there is no retreating back. The death is almost certain. It's almost 100% fatal in this case. As you can see, it's not going on. What is? Your intervention, your medical intervention is no more beneficial for that person. Incubation period, it is usually 2 weeks, but it can go up to as long as 6 months, and it is reported as short as 4 days. Symptoms, how quickly they appear, they also depend on location of the bite. If the location of the wound in some proximity, it will take more time to travel to the severity of wound. We all know the 3 categories of the wound, category 1, 2 and 3, that actually dictates how quickly the symptoms could appear, and then amount of virus introduced. If the dog is rabid and the viral load that is transmitted through bite is higher, it will definitely gonna bring the symptoms earlier. As you can see here, actually when the virus enters into the site, we have almost a window of 7 to 10 days, that is called the prodromal phase of the rabies, where any sort of interventions or diagnostics you can have it, and you can treat that particular person. But once the prodromal phase is over, the treatment is not possible. So we just got about 8 to 9 days, where if there we are to perform any diagnostics, so we are to provide any kind of medical interventions, we can provide that person. Type of contact with the animal, again, there are 3 types of contact. First, if there is only touching of the animal licks, there is no abrasion of the skin. In that particular case, no treatment is required. Generally, category 2 wound is kind of where there is breach of skin, but there are no proper abrasions. Here the immediate vaccination is required, but in case of category 3 wound, immediate vaccination as well, and person is unable to move, and then there is furious rabies, where there are uncontrolled motion of the bodies and aggression of signs of aggression. Virus is transmitted through bite into the wound. So there are 2 options. First, if we can manage the wound properly and treat the in case of rabies, what are the 3 pillars of rabies prevention and control are animal population control, animal vaccination. These are kind of interventions that are beyond our control, and it needs national level control programs and everything. But what we can do in our capacity is kind of spread awareness about the proper treatment of wound, and having worked on rabies a bit, we have seen some very unfortunate incidences, like red chilies being sprinkled on the wound. I've personally seen this, and they believe that this could eliminate the virus and rabies won't happen. Then this coin, 1 rupee coin, they'll place it on they won't and wrap it up, and they'll say that if the metal is there, the virus can't survive and there will be no rabies. So this is a sort of thing that being biological professionals we strongly would want to deny and come up with the more rational and more feasible idea. So first option that immediately could be done is proper washing of wound, and almost all the viruses, specifically talking about this Lassa virus, it is susceptible to soaps and other detergents and agents. So proper washing of the wound for 10 to 15 minutes with a soap could help eliminate the virus or wash out the virus. If soap is not available, simple washing of the wound for a longer period of time, 10 to 15 minutes under the tap water, is sufficient. And next thing that you need to take care is do not suture that particular wound. Immediate suture would ultimately lead to actually the safe haven or a place where virus could reside, and ultimately it can lead to rabies development. So washing of the wound, do not suture it, give the routine precautionary measures whatever is needed for the routine wound treatment, and obviously give the immunoglobulins and as well as rabies vaccination. This is an example of wound site, how you would manage the wound. For example, in this particular case, we have a bite on the face, so this needs immediate and more prompt attention as compared to one that is on the foot. So it is and it will kind of give us the time for the wound management, but in that case where the face is involved, immediate attention is required. Again, as Dr. Ansari mentioned, Louis Pasteur was the one who invented rabies vaccination, and he was himself the first person to get the rabies vaccination shot. What are the rabies vaccination? There are two types of rabies vaccination: pre-exposure and post-exposure. Pre-exposure vaccination, it includes veterinarians, all the people from the corporate financial burden it could inflict on the world, having all those immunoglobulins being injected. Post-exposure prophylaxis consists of two things: rabies immunoglobulins and anti-rabies vaccination. As we have biological production, previously have different sources of vaccination, but nowadays we have this cell culture based vaccination. Vaccine administration, the animal side is vaccinating the dogs, they are doing the neutering work, and the human health departments, they are properly providing the pre-exposure and post-exposure vaccines. Take home message.
Very warm welcome to all of you for this thing, but I truly believe sitting inside rooms with the ACs on and having presentations we would not be able to eliminate rabies. We have to go out, we have to go door to door, we have to launch a massive awareness campaign, and only then we can resort to at least curtailing. I would say it's not easy to eliminate rabies. It still exists, especially in the developing countries, quite rampant. And I think we take this opportunity, especially for the media, to please help us out in launching the awareness. बहुत हम जोर सुन रहे हैं. It's very unfortunate that we saw a case, a child dying of rabies. It really gives us a lot of pain once you see such things. But what have we done? I think prevention is far better than treatment, far better than spending so much. Where are we standing today? We're talking about vaccine, availability of vaccine. Let's take this as an opportunity to do something. It's a challenge right now, but the best part is converting the challenges into opportunity and then cashing them. As far as National Institute of Health is concerned, we are all ready to pick up this challenge. We are already striving very hard for vaccine production within NIH, which remains to one of our mandates. But I think we have to go much beyond that. Right now, rough estimates say that around 5,000 deaths of rabies occur annually in Pakistan, which is again very unfortunate. And then the amount of doses that are required for rabies treatment are around 10 lakh for the country. We all understand the private sector is for the private sector responsibly rests with the Drug Regulatory Authority of Pakistan, but for the public sector definitely we are moving on with the anti-sera production. Alhamdulillah project is almost in the final phase, whereby we will be able to complete it inshallah by December this year, and we'll be able to produce anti-sera requirement for the whole country. And that will be the time that we can even move out to the private sector as well. For the rabies production, we have already produced during this year 2.2 million doses which have been dished out. So we cater the public sector. That's something again important that you need to know. But again, I'd request, we've got people from the epidemiology division especially, it's their domain. We have already established a risk communication center as well. It's time to move out. It's time to tell the people about. It's time we need to take care of the stray dogs. इतने ज़्यादा ये stray dogs पाए जाते हैं, उनका क्या करना है? Sterility is one of the answer, but it's not an easy job considering we have limitation of sources. So what to do about them? But again, सफाई सुथराई, that is again important. और दूसरा ये कि सबको पता है, if you keep keeping pets, you have to regularly vaccinate them. And ये तो अच्छी बात है कि ज़्यादातर हमारे यहाँ rabbit dog केस से सिर्फ होती है, बाकी there are few other examples as well. Fortunately वो इधर मसला नहीं है rabies का. But once rabies gets established on neurons, unfortunately the process is reversible. So after the bite, till the time the rabies gets affixed to the neurons, that is the time to basically treat the patient. ऐसा है जिसको भी पागल कुत्ता हम जो आम ज़बान में कहते हैं. But again, coming down to a level, ये program, this comes under the rabies vertical program comes under Pakistan Health Research Council. So we are trying to again bring it under the domain of NIH as a vertical program, and inshallah we are quite sure that with the passage of time we will do our best. But come what may, as we are the people dealing with public health, it's our duty as well. And I think we need to set the modalities. We have already worked out a smaller version of piloting in Islamabad about rabies, and we are working on yet another project so that we get an international grant and we start actually implementation. I am a true believer. Things are very good in book. I mean, you can find all the policy, you start Googling. But what about the implementation? That's the practical. That's I would like my teams to move out of their offices, see around, guide the people. And I think taking opportunity, I mean, right now about the dengue. So I think I would request Dr. I was just thinking to discuss with all of the senior colleagues from the epidemiology division that we take the permission from the ministry and we start going to the schools and academic institutes for a very short, meaningful, brief lectures and hands-on training on hand hygiene. So these are the things that we can tell. Long time back, I being from the military side, the instructions used to be very strict. Okay, long sleeves पहनेंगे और रात को कैसे सोना है और मच्छरदानियाँ. जो आगे जाते गए वो चीज़ें मैं देख रहा हूँ सिविल सेक्टर में बिल्कुल. We need to be very careful. A small little mosquito which can transmit so many diseases. So we need to take care and we need to guide the masses. Unfortunately, the masses in our country are not yet aware. As I again request to the media to highlight all these things for the general public awareness, how to protect simple methodologies. And that's what you need to do. So I think we sit down for this thing, we prepare plans, especially for rabies, dengue. I mean, the time the world is in transition from the infectious disease to the non-infectious side, and unfortunately we are still striving because I think rampant infections are causing lot many devastations, and then definitely a huge burden costing that goes down to the government. So thank you so much for organizing this event, but I'll be much more happier if you're walking around in the streets of Islamabad giving this message. And even yesterday there was a dengue pamphlet and I told them we've got an epidemic cell, got a nice vehicle, why not to utilize it? Because even seeing that vehicle, people would know there is something, a public message is going on. So let's make the thing more practical rather than within the conference rooms, and more bookish knowledge which is available over there. सादा अल्फाज में सादा लोगों को सादगी के साथ समझाइए कि उन्होंने करना क्या. That's the important thing. Thank you so much. Thank you.
एक मिनट जरा वो शॉर्ट शूट ले लें. चलते हुए बना लेंगे ब्लॉग. आ जाए आप लोग निकले ना आगे आ जाए. फोकस कर गए हैं सारी. बनाना है अच्छा.